because history has taught us that there's always a downside. Everyone, and we also like to keep an eye out for these potential downsides, because ultimately it's very important to be aware of whatever else it can happen. But the advantage here is that these mediators are not inhibitors, and what we've used till now always inhibits something. These mediators are actually agonists, and this is, I think, one of the reasons why, at least for now, there has not been reported downsides. Even within the clinical trials that have been done with analogs of these mediators, there's no adverse effects reported. And also the other thing that's different of these mediators to the classical pharmacopoeia is that it's not they don't need to be present in the body, in the tissue at a particular time for their actions to be still present. They have knock-on effects, so they regulate other things that are host protective. They upregulate pathways and processes when they're administered that then later on, days, weeks, months even down the line, are protective. So this is a very important difference to our current treatment regime. In an ideal setting, one could even think that you can dose your patient once and then send them home and they're happy. Obviously, this would need still to be demonstrated, but this is the type of approach that we think is very important, and the actions of these mediators, why they're different to what we already know. Because even administration of one pro-resolving mediator, we found upregulates the endogenous production of others. So you can think about a drug that resolving as a drug and giving essential fatty acids so that you can improve the next wave of endogenous production.
You haven't mentioned safety. You've alluded to it. Sounds like there's not a downside to it, but with fish oil, everybody does worry about the anticoagulation effect, the interference with coagulation and an operative procedure. These sound like more powerful agents. Is there any hint that they're going to interfere with and cause bleeding?
As far as we know, we've not seen any delay in bleeding times in animal models. Obviously, again, in humans, it might turn out to be different and would need to be tested. As to other side effects, as we like to call them, we don't really see, even in humans, in phase 1, phase 2 clinical studies with very high doses of these mediators, there's not been any reported negative effects. And there's now, if my last count is correct, about 4 or 5 phase 1 trials that have been done with different mediators.
Are there any chronic conditions like smoking or chronic alcohol abuse or pharmacologic drugs that would affect P450 system or some kind of that would reduce the efficacy? I don't expect it to inhibit the drug, but reduce the efficacy of these SPMs.
So smoking, we've done some work, some preclinical work with a group in Rochester looking at smoking-induced COPD, and we find that there is clearance of the inflammatory response locally and also systemically, and amelioration in breath. We've looked in breathing, we've looked also in models of asthma, and even done some ex vivo work with asthmatics, looking at the ability of these mediators to regulate leukocyte responses in asthmatics and to help the resolution of asthma. And there's clear signs that these can be very important. Whether there is specific conditions that may change, we don't have any evidence. Cytochrome P450s are important in a portion of they're one of the pathways that by which these mediators can actually be inactivated, or at least we think they are important. But the thing is that there's multiple pathways. There's prostaglandin dehydrogenase pathways, there is oxidoreductase pathways. So I think there's enough ways by which these mediators can be eliminated from the body to avoid what as a pharmacologist one might think to be a dangerous dose.
Right.